Coming up today, strength, flexibility, balance, plus community. Today, we see the benefits of exercise at a gym specifically for people living with Parkinson's. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Parkinson's disease currently has no cure, but living with it doesn't mean you should just sit around waiting for the symptoms to get worse. Today, we are meeting two men who took action and found a local resource serving hundreds of people just like them. But before we get to that, let's get to our COVID count this morning. Dr. Dana Hawkinson joins us remotely from Olathe. This week's numbers, as we know, those active inpatients jumped to 33. Doc Hawk, how many of those were in the ICU?
Yeah, unfortunately, we had some severe illness with that. Just as you said, we have 7 in the ICU this week. So unfortunately, with the total numbers going up, we are seeing an increase in those severe illness numbers as well.
So take us back. When was the last time the COVID census was this high?
Yeah, you have to go back to March. We had just over 30 as well. I think it was 33 or 35, around the same number it is now, but we've had relatively low numbers since that time. Unfortunately, we're creeping back up. We should add that in January of 2023, we had 59 inpatients as well. So hopefully the numbers won't climb up to that peak, but you never know, and we always have to be vigilant and ready. And certainly the health system is ready to treat those patients. But if we can do anything, I think it's just good to continue to endorse prevention and reduce your risk of hospitalization. That is, have a plan if you have symptoms. Number one, get tested. We know influenza is circulating out there as well, but get tested early. If you can and you're a candidate, get on the oral antiviral medicines. And then, of course, get vaccinated. That will help reduce your chance of hospitalization and severe disease. And we know that a lot of people have had it in the warmer months. We were recommending, waiting that 3 months after that acute infection, if you'd had it recently, to then get that new updated vaccine.
But is this uptick as we start winter really just something we should expect from now on? Is winter simply kind of, quote, the COVID season now?
Yeah, when the pandemic started, it was just kind of all over it, any month or any season. And that was just because people didn't have any individual nor community-based immunity. We didn't have vaccine, and we didn't really have good oral antivirals to use in the outpatient setting. But now it is looking as if there is more of a seasonality to SARS-CoV-2 circulation, to COVID-19. Now we know the virus is still circulating out there at all times. Compared to other viruses, it seems to be in higher circulation, even in the warmer months. But I think we are starting to at the increased seasonality of this virus in combination with those other common cough and cold viruses that we talk about during these cold months, during this respiratory viral season.
Hawk, thanks so much. Good to see you this morning.
Thank you.
Turning back to Parkinson's disease, treating the disease can be complex, but sometimes the best treatment is the simplest treatment. Alexis Del Cid takes us to a gym where exercise is helping people fend off symptoms.
Open your right hand towards the ceiling and stretch it back.
The stretching, the ladder drills.
You have 10 punches or whatever you want.
The heavy bag, the speed bag. This gym is where coaches train fighters, but not to take on each other in the ring. For people like Dan McDonald and Dan Monks, the battle is happening inside their own bodies. Both have Parkinson's disease.
1, 2, 3, 4, 5.
And their neurologists have sent them here to the Parkinson's Exercise and Wellness Center as part of their treatment.
Footwork, endurance and coordination, sequencing of punches, hand-eye coordination are all beneficial for the brain, especially a brain with Parkinson's disease.
Sarisa Curry is president, co-founder, and head coach at the gym.
There's also a lot of research when it comes to forced, intense, vigorous exercise, and boxing is a great way to increase cardiovascular output, bring their body up to a higher level of fitness, and all of those help with fighting against Parkinson's.
This is hard.
It's a good kind of hard. Both McDonald and Monk say these classes have not only slowed the progression of the disease, but also improved their ability to function on a daily basis.
I'm stronger. I can get up and out of bed. I live on my own now. It's me. I got to take care of me. And it made me stronger to be able to do that. The exercise class here at the Parkinson Center.
It's improved tremendously because I'm exercising one way or another 6 days a week.
Classes that give them inspiration, camaraderie, and support from others going through the same thing, and the confidence to keep fighting.
Good job, guys.
Joining us in studio now is Theresa Curry, president, co-founder, and head coach at the Parkinson's Exercise and Wellness Center, along with neurologist and movement disorder specialist Dr. Kelvin Au. Good to see you both. And also here with us today is Dan McDonald. He's here in studio with us. We saw you on the video working it out. We're so glad to have you.
Thank you.
And Dan Monks, he is joining us virtually this morning. Both of them live with Parkinson's, and they've gotten to know each other through some of these classes. We're going to talk about that here in just a moment. But Theresa, let's start with you. Talk to us about what your personal connection is to Parkinson's.
Yeah, well, now my personal connection is quite involved. So at this point, I work with people with Parkinson's every single day at varying levels. Previous to that, I really didn't have a personal experience. I was really just doing life, teaching a lot of group fitness classes and doing personal training. When, kind of the need found me, so people with Parkinson's were looking for a boxing class in this area. There was not a boxing class in a 4-state region. And in hearing so many people call and ask, I was like, I wonder what this is all about, and I wonder if I can help. And that's how I got started.
That was my next question was, where did you see this need? And it was people coming to you and you kind of entering to this new world of Parkinson's that you've never experienced before.
Yeah.
Filling the void.
Exactly.
So tell me a little bit about the genesis of creating the program. How did you know where to start and what those specific needs were?
Sure. Well, really, I know one of your questions later will be, how long has exercise been considered a therapy? Mm-hmm. Really, in the last 10 years, that has evolved to be something much more significant as a therapy for Parkinson's. But back in 2015, Rocksteady Boxing, which is based out of Indianapolis, was given a national platform with Leslie Stahl in the CBS Morning Show. And her husband was performing in a boxing class, and it was really just a powerful video. Monday morning, people started calling around and looking for places for their loved one or for themselves with Parkinson's to do boxing. And at the time, I was working at Title Boxing Club at 119th Street. And that was a place where local people here were calling to say, do you have a Parkinson's program? Do you have anything for my loved one with Parkinson's? And the answer was no, but we took names, took phone numbers, and I really started to look at what that would look like for me personally to take on a group of people that I really didn't understand what they were dealing with. Yeah.
And two of those names eventually became Dan and Dan.
Yeah.
You have both of them in some of your classes. Tell us a little bit more about the types of classes that you offer. Is it just kind of one size fits all, or are there certain exercises and classes that are better for different patients?
Sure. Well, and that goes back to the evolution of the program. Mm-hmm. We started with Rocksteady specifically and have expanded the program significantly to include stretching classes, weight training, dance classes, mat Pilates. We have a Fit to Care program for our care partners. Really just a great deal of variety for exercise.
Different classes for different stages of Parkinson's?
Yeah, so the DANs, as we'll call them today, their goals are to stay very active, to golf, to be able to travel and do golfing, to have a very high quality of activity. We also have individuals who are looking just to maintain their independence in their homes, so can they continue to dress themselves and take care of their homes. And then finally we have people who are just looking to stay as active as possible.
And some stretching. I mean, that's almost should be a part of everybody's daily routine. Tell us a little bit about that.
Yeah, with Parkinson's, one of the main symptoms and one of the debilitating symptoms is rigidity. So stretching, making sure that their entire body stays mobile so that they can do the activities that they need to do to be healthy and functional.
So let's head out to Dan Monks. Good morning. So glad you're with us today. Tell us what your first sign of Parkinson's was. When did you know?
Yeah, it was right at about 3 years ago, and we were having Thanksgiving dinner, and my brother-in-law sitting across the table said, Dan, when did you start having that tremor? I said, what are you talking about? He says, your right little finger is twitching. So I looked down, and when I look down, it's not twitching. Of course, when I look away, it starts twitching again. So he convinced me that I needed to go get a little bit of analysis done. And from there, went through and got the diagnosis and got the a second opinion on it, which was also the same thing, that I had Parkinson's. Then I muddled around for about a year before joining the club that Teresa is talking about.
So glad you found her. But going back to sitting across a dinner table, it's that time of year. We see family we don't always see all the time. So they're able to see maybe things in your day-to-day life that maybe that have gone unnoticed. So that was just an interesting point that your brother-in-law had noticed. So tell us a little bit about your activity before your diagnosis. Has this, has this been a huge lifestyle change, and in what ways has it changed you?
Well, I happened to retire about the same time that I got diagnosed, and I love the game of golf, and so I play golf as much as I can and do a lot of stretching before and after. That counts as exercise. And then during the rest of the week, there's, when the weather's not just perfect, then I'm able to hit the gym and do the exercising, and it's got to be, I got to combine the two of them, the passion I've got for golf and exercise, the passion I have for me. So, yeah.
Have you noticed a big difference since you started taking the classes?
No question. I was in decent shape. My weight's okay, and most of me is okay. But without question, the things that I was able to do is, you start losing your balance a little bit is one of the things that can happen in the stretching that we talked about. And the exercises that we do help alleviate that and help keep that in the background. So yeah, it's a huge difference.
And that's why your phone rings a lot, because you hear people who are already active, and then implementing this into their lifestyle and already seeing that big difference. Let's go to the other Dan. Let's talk about your story. When were you diagnosed with Parkinson's?
2017.
What do you remember about those first signs?
I was just terrible. I really couldn't function, couldn't walk very good, had a difficult time executing things, fatigue, soreness, which was just kind of all related to back problems and situations like that. So it was kind of hiding and masking. And, my stupidity was, I wasn't willing to go seek things out. Hey, this will get better, this will get better, this will get better. And, it never was, but I was so stubborn that I didn't want to, admit that I had a problem.
Well, and I like what you said, things get masked as we get older and we start to just get used to things not feeling right, and then we miss some of those signs. How active were you before that diagnosis?
I played a lot of golf. Dan and I are both in love with the game of golf, so very active with golf, had a full-time job, was working in the transportation industry, and was performing duties as usual. But it was getting tougher and tougher every day, so, I was just kept staying with it.
Well, so when did you find Teresa? That's, when did you know you needed to do more?
Actually, I saw the same thing on the CBS Morning with
You remember that?
Absolutely, I most definitely do. And the time my wife said, hey, you should go check into that. And at that time, I still wasn't ready to admit that I'd had anything. This was before I'd even seen Dr. Powell here at the KU Center. And then I did get finally diagnosed with Dr. Powell. And then I decided, well, you know what? I came and visited a class. We were down in the basement of the old Ranch Mart shopping center. It's kind of a cool little place. Everybody was so quiet, tight and knit in there. And we just started working out, and I love this. And I thought, maybe it's not for me yet. I wasn't to that point yet. I'd started taking the medication, carbidopa, levodopa, which did wonders for me. And I thought, okay, I can go do this. And if I can't, for me, I can do it for myself, or I can help other people that maybe I'm a little stronger that I can help them with.
So you stuck with it?
Yes.
Now, how many times a week are you working out?
Sometimes I go as many as 6 times a week.
I think we have some video
5 to
of
6
you
times.
all working out. Tell me what it is when you're in class. Are there some movements that you feel work and help you better than others? And how do you kind of strategize when you're in there?
It's just physical activity. You get your mind off of it, and you just kind of feel like, hey, I'm not that bad after all. I can still do this stuff. I'm a pretty good sized guy, and I've taken care of myself. And, I just felt more active. It's a camaraderie, people work together. We each talk to each other, try to help each other through the process.
It's a camaraderie.
Yes.
And it's not just the boxing, because you're brought together by this disease.
No, we cut up,
Yeah.
have fun, you know, joke with each other. Dan and I are always giving each other the business.
Yeah, Dan, what's it like being there, hitting the bag with your buddy?
Oh, it's great. It's great. We're going to drop the gloves and play a little hockey here soon.
You guys are not slowing down. Well, I like that, because you're active, and it's like, what do I have to do to stay active? You're not going to let this disease just run you down. I want to bring in Dr. Kelvin Au, because you know, we think of exercise. That's kind of, I don't know if we've had a doctor on here that hasn't said exercise is, you know, the way to go. But when did we start knowing that exercise is medicine when it comes to Parkinson's?
We've known for a long time that it's part of Parkinson's, but as Teresa said, it has been really widespread knowledge amongst the community and people with Parkinson's. So programs like this, we see them springing up around the area, and they become more and more popular as the years go by.
And as you hear the story of the Dans, it must be like music to your ears to know that, you know, when you go and tell another patient to go and try this, that there's a decent chance they're going to have really good results.
Yes, absolutely. And I tell my patients that this is something you expect your doctor to say, that exercise is helpful, but it truly does make a difference in people with Parkinson's
For this,
symptoms.
for this specific disease. So what are the main symptoms of Parkinson's, and how would someone know to seek more attention on it?
The main symptoms of Parkinson's disease are tremor, slowness, and stiffness. The tremor can begin in one hand or the leg, and it can begin as just a small twitch, as Dan mentioned. It typically happens at rest, meaning when you're watching TV, your hands are on, you're sitting on the couch, you're maybe reading a book, you're trying to go to sleep. That's when we notice the tremor the most. People with the slowness and stiffness, the rigidity that Teresa mentioned, people notice that they're not walking as quickly as they were before. They're taking shorter steps, they're not swinging their arms as much. Their loved ones may notice that they have reduced facial expression, they're not blinking as much. Sometimes people put it off as just, oh, this is just me getting older, like you mentioned, kind of, oh, this is just my back aching or shoulder aching, etc. But eventually it gets to the point where, oh, you should go see your doctor about some of these symptoms progressing. Those are what we call the motor symptoms of Parkinson's, but Parkinson's, being a brain condition, can affect many different systems in the body and have many other symptoms. Those include mood symptoms like depression and anxiety. It can affect your sleep, memory and thinking, constipation. So there's lots of other symptoms that we see, and we say sometimes the tremor is just the tip of the iceberg.
So medically speaking, and I'm going to ask Teresa when it comes to being in the gym, but medically speaking, what is, how is the boxing itself and those movements translating into helping the Parkinson's?
Yeah, so people with Parkinson's are combating that rigidity. The muscles are tighter. They're not getting the full range of motion with their movements. They're not extending the joints to the full capability, and the boxing really trains them to do that in a fun way. You kind of have to get a full punch, you got to stretch out your muscles, and that really helps with the movements on a day-to-day basis.
Teresa, what are you seeing when you're these are patients for these doctors, but then they come in and they're taking your class? How are you helping them manage this?
I would say, we have a slogan in our gym called, if it doesn't challenge you, it doesn't change you. And I think most people always ask the same question: what is it that you're doing that is beneficial? If when they come to the center and they're there for an hour, 2 hours, if the hardest things that they do there are stepping over cones, stepping up and down, stepping through ladders, pushing their bodies to the level that makes them sweat and breathe hard, when they leave there and do their regular activities, those things are much more manageable. They have the confidence, they've built up their confidence that day. They've awakened their brain to the ways of, hey, I'm going to look and step over this rug instead of I might trip over this rug. Mm-hmm. So I think there's a lot of different levels of challenge to the brain that we do in every single exercise that we do that helps them to live a better quality of life when they leave.
Dr. Au, let's talk medicine, because Dan had mentioned that he was on a medication that was working really well. Do you prescribe exercise and medicine to coincide with each other?
Yes, and they complement each other. Mm-hmm. We prescribe and talk about exercise at all visits of when we see people with Parkinson's. And I tell my patients that they need all three types of exercise. I break it down into aerobic exercise, getting your heart rate up, flexibility and stretching exercises, and then weight resistance and strength training, all of which are part of the boxing classes there. But if you can get one of all three categories, that makes a big difference.
And you mentioned as the stages change, the classes may differ. let's talk about that when it comes to treatment. It's certainly not one size fits all when it comes
Right,
to treatment,
yes.
but as that progresses, how are you managing that and treating the disease?
So as mentioned, Parkinson's, we don't have a cure, and it will progress over time. The symptoms increase, and there are different stages of Parkinson's. As as the stages progress, we do need to use different medications to help with those symptoms that come up, both the motor and the non-motor symptoms. You mentioned this medication called carbidopa-levodopa. Eventually, sometimes that needs to be increased, as well as taking it more frequently, as well as adding on other medications to help extend the life of the carbidopa-levodopa, which helps improve the symptoms, and that varies from person to person and as the stages changes over time.
So when you meet a patient, how soon are you bringing up the idea that exercise is part of your treatment plan? Because I'm sure there are people who are exercise resistant. So how do you bring that in as like a legit way that we're going to help fight back on this disease?
So we bring it up from the first visit. We talk about exercise. People sometimes are coming in and this is the first time they're hearing the words that they have Parkinson's disease, and they may not be ready for the idea of medications, but we tell them, look, this is something that you can do. We know that it can help slow down the rate of the progression of Parkinson's disease. It's the closest thing that we have at this point in time. After our initial visit at our Parkinson's Center, we do have a coordinator from the Parkinson's Foundation that reaches out after a couple of weeks and looks at that person, calls them and tells them, hey, look, in this area, the Parkinson's Exercise and Wellness Center is close to you. You should check it out, or other areas wherever the patient is. And we suggest that and get them plugged in, as well as with support groups.
Well, and when you hear that, Dan, it sounds like you have some control over it. It's not just I'm waiting for some treatment to take over. I get to be in control.
Exactly. There's several of the people that come to the gym that are not yet on medication, and they don't want to go on medication yet, so they've chosen this path, coming to the gym and working out and staying healthy and moving as long as they can until they have to resort to medication.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. All of that info is right there on your screen. We've talked a lot about the camaraderie. It's not just the movement and the exercise and battling Parkinson's. It's a mind game, too. Sarisa, tell us about a recent gathering you all had over the holidays.
Oh, yeah, our annual Christmas party. So we have social events every single month. We have some that have become yearly favorites. We have for the past 5 years gone to the Thompson Barn in Lenexa, and this year we reached capacity, so we're going to have to look for a new place next year. But we had 150 people gathered for dinner, Christmas carols, just socializing and getting to know other people in the program.
Love it. Dan, tell us a little bit about what that's like. I mean, again, you hit the bag, but then this is expanded to a much bigger scope. It's community and it's love and everybody kind of being in this together.
Yeah, absolutely. I think the biggest thing, the number one thing that I get out of the classes is as you mentioned, the camaraderie. It's the inspiration of like, I really don't want to go today, but Dan I'd say, if I didn't show up at the class today. With the variety of classes, there's no excuse really. But yeah, I guess that sums that up.
Do you agree?
Absolutely, most definitely agree. There are so many different classes and things that the gym provides to us. There really it shouldn't be an excuse why you shouldn't get up and come try and do what you should be doing to keep yourself healthy and able to enjoy life as best as you can.
All right, let's get to some questions from our viewers. And we have one about if somebody's struggling at the gym or maybe is new or just struggling to keep up, how do you jump in and help them feel comfortable?
A lot of times we don't have to. A lot of times the other class participants will really be supportive and encouraging. All of the coaches are at this point pretty extensively trained in Parkinson-specific exercise. So if someone's struggling with a certain move, whether it's too challenging or causing pain, or their strength is just not there yet, we can find numerous modifications to make sure that they're working in that same plane of motion, but not extending themselves in a way that's going to be harmful to them. And then, like I said, their fellow fighters will come up and support them. We often partner stronger fighters with weaker fighters, just as a form of encouragement and to just I don't know, encourage bigger and healthier movement.
Lisa wants to know what's it cost to take the class, and tell us again where you're located.
Sure. Well, we are a nonprofit organization. We do have a fee for services. However, we'll subsidize membership for whoever needs financial assistance. At this point in time, we have 43 classes a week, 6 days a week for all levels, and it's $140 a month for unlimited participation. And we're located in Ranch Mart Shopping Center at 95th and Mission.
And Jason wants to know, do you need to be referred to your center from a doctor, or can you just show up?
Nope, you can just show up as long as you have been, well, we actually have some people who are awaiting their diagnosis. Unfortunately, the neurology departments are overwhelmed with people who are waiting to be seen. So in good faith, if someone thinks that they have Parkinson's, they are on their way to a diagnosis, we will get them started.
Get them
Absolutely.
started. Lynn wants to know, doctor, what's the difference between a neurologist and a movement disorder specialist?
Yeah, so a movement disorders specialist is a neurologist that has gone on and done extra training in Parkinson's and related conditions. So an extra year or two of training on top of their neurology training.
So what he's saying is he's very, very specialized. That's his kind way of saying that, bragging on you a little bit. Macy wants to know if Dan, if you were intimidated by your first class. I think you mentioned you just kind of went in and went after it.
That's pretty much the way it was. I was not intimidated. I was like, I thought, well, it's the same people that I am anyways. So
right.
I mean, you just jump in.
Yeah, Dan, the other Dan. What about you?
Yeah, I'm kind of a type A, so I just bulldogged the way through. And the people there were they're greeting you, come to the club, welcome here. And it's real quick that you make a whole bunch of new friends, 30 of you that just came off the mat sweating and trying to get some oxygen in your lungs, and you got the guy coming up and give you a little pat on the back of the head and say, good job today. And that comes from the warriors, we participants that have the disease.
I love it. I love it. Last question. Alexis wants to know, Dr. Au, you mentioned Parkinson's can affect your cognition. Can you talk more about that and how exercise helps with that part of the disease?
Oh yeah, so it affects Parkinson's affects the cognition. It can affect memory, but more often it affects attention and also abilities to multitask. So exercise, these movements that are done at the boxing classes are quite complex. You need to make sure your stance is okay. You need to pivot your hips and then reach out and strike the bag. That's multiple tasks all at once, and kind of doing that repeatedly will help with getting blood flow to the brain, and then that can also help with your attention. And people tell me afterwards, after those classes, they're feeling more sharp, more clear, mental clarity. So that's how it can help.
And just before we go, what are you looking forward to most when it comes to Parkinson's treatment? Is there anything on the horizon that excites you? Leave us with a little bit of hope.
Yeah, so there's new treatments always in development. We do a lot of research trials at the KU, and you can get our newsletter to see if you might participate in some of these research trials. But what I see coming down the pipeline is that the medication that is the mainstay treatment for Parkinson's, carbidopa, levodopa, they're coming up with ways to how to extend the life so that people aren't taking it 3-4 times a day. They can take it once and it'll last most of the day. There's ways that they can have it as a pump underneath the skin. That's coming up soon as well, so people don't have to take oral pills every 3 to 4 hours. That's what's coming up down the pipeline.
All good stuff. What's the takeaway from our conversation today?
Exercise helps, and you've got to get one of all three: aerobic exercise, flexibility and stretching exercises, and weight resistance and strength training. All three of those. Dan
Monks, what's your words of wisdom?
Words of wisdom: show up and participate.
Other Dan, what do you got for us?
Wholeheartedly agree with Dan. That's what you got to do. You got to get yourself up, and you got to make yourself do it and go do it.
So you're saying if somebody has Parkinson's and they want to try, you're going to be there with open arms, ready to go, and fists.
Oh, they'll be my best friend.
I love it. I love it. Sarisa, thank you so much for joining us and talking about this. What's the big takeaway from our talk today?
I think, as always, if you are a person with Parkinson's, whether you've just been diagnosed or you've had it for 10 years, no matter what stage of progression you are, there's a place for you with us. As long as you can get there, we will make you feel comfortable, confident, and give you hope that you're going to be all right.
Thank you to all of our guests for being with us today. Thanks to our viewers. We'll see you back here tomorrow. It's called the Angelina Jolie effect. More women than ever are having their breasts or ovaries removed just in case they get cancer. I'm Jessica Lovell on the next Open Mics with Dr. Stites. Risk-reducing surgery. We ask doctors when it makes the most sense and hear from one woman who made a drastic decision based on her genetics. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.